All right, good afternoon, everyone. Welcome to today's installment of the Regional Report, a GPEC virtual series. Let's talk about today. GPEC was selected by the EDA as a finalist in the $1 billion Build Back Better Regional Challenge and awarded a grant of $500,000 in Phase 1 to support the development of the Phase 2 proposal. Now, GPEC was one of 60 finalists selected from the 529 applicants. As a finalist now, GPEC will compete for up to $100 million in American Rescue Plan funding with the goal to develop and scale the new healthcare innovation economy in Greater Phoenix. So this webinar today, which you're attending, will feature experts highlighting the pillars of Greater Phoenix's BBBRC proposal and the future of healthcare in the region. So thank you so much for joining us. I'm Eric Sperling. I'm the founder and managing director of the Social Television Network. All of our shows and segments are dedicated to local leadership, community growth, and actionable solutions. If you haven't downloaded the STN app yet, I invite you to do so. It's available on the App Store or Google Play. I've had the opportunity to do many a segment with GPEC President and CEO Chris Camacho. So always thrilled to be creating content together and delivering great news and great information like we're going to do today. All right, some housekeeping items. If this is the first time joining us on a regional report, today's webinar will run for approximately 1 hour. Audience members are muted and without video. This webinar is being recorded and will be shared on the GPEC website and social media. You may submit questions today using the Q&A feature at the bottom of your screen. Due to time constraints, though, we may not be able to get to all those questions. Should you experience any technical difficulties at all, please try logging out, logging back in. That sometimes tends to fix it. And we do, of course, invite you to share this information on social media, but please feel free to tag GPEC and use the hashtag GreaterPHX together where appropriate. All right, I know their cameras have been off. We have 5 speakers joining us today. We'll be hearing from Jasmine Bhatti. She is the founder of Navi Nurses. Mayor Kate Gallego, of course, City of Phoenix. Dr. Richard Gray, Vice President of Mayo Clinic and CEO of Mayo Clinic in Arizona. Kathleen Lee, she is the Senior Vice President of Regional Initiatives at GPEC, and Ehsan Zaffar, Chief Difference Engineer over at ASU. So before we get to our panel, I do want to kick things off with Chris Camacho, as I mentioned, President and CEO of GPEC, to go over the background of this important grant. Let me give you some background on Chris, too, in case you're not aware. As Chief Executive, Chris has been instrumental in the region's technology and advanced manufacturing sector growth, led the attraction of more than 460 companies during his tenure, creating nearly 85,000 jobs and $24 billion in capital investment. Chris, it's great to have you back on the Regional Report. Good to talk to you. I'll turn it over to you to help set us up today.
Awesome. Well, thank you, Eric. And what an esteemed panel you have coming your way next. This is a great time to be back with our investors, our partners in the community, trying to build a more resilient and anti-fragile economy. It's also great to be back in Zoom, I guess, because we've been doing a lot in person lately. So this is a kind of an alter ego from what I've seen the last several weeks. But with that said, I'll be brief today. And I did want to provide just a few comments as an introduction to this Build Back Better Regional Challenge opportunity. As you described, in the fall of 21, the Economic Development Administration of the federal government announced this 2-phase competition called the BBBRC, or the Build Back Better. And it was all focused on developing transformational regional economic strategies that would be done in this 2-phased approach. And so the Build Back Better effort as part of the EDA was really to look at organizations and regions that could harness regional industry clusters, as well as ensuring we balance the legacy sectors of our economy with where the puck's going, where the markets are advancing to, all as an outcome to be focused on growth strategies that would drive high wage jobs, increased wages, revitalize communities, and so forth. And so we had such a great time, albeit challenging time, working with so many different organizations that wanted to lean into this opportunity. We had a lot of different sectors we thought about, including semiconductors and advanced electronics, energy. There were so many different focal points. But what we found was the need around healthcare transformation was such a critical need for our community that we put all of our efforts into advancing the cause here. So as many of you know, the Phase 1 was simply a $500,000 technical assistant grant that enabled you to create a more detailed proposal or application. The feds asked us to create in the range of 3 to 8 distinct projects that would advance the regional industry cluster position. And as you mentioned, Eric, there were 529 or so organizations that submitted for this around the country. And fortunately, GPEC with our partners was one of those selected as the top 60 finalists. So outside of that, you have the EDA, which is looking at 20 to 30 finalists, as we mentioned, and $100 million available. And that $100 million is going to go to these number of regional systems. And I probably don't have to share much with this group, but our changing landscape around healthcare, delivery of care, quality of care, as well as our base industry innovation cluster that resides within healthcare is very significant and ever evolving. And even technology available to our hospitals, to our clinical settings, it's increasingly changing to be focused on quality, but also access and ensuring that patient care and that access at home and throughout the community is, the needs are being met. So this regional coalition that we were a part of and led was really built by this 18-member effort with 40 plus different organizations that all leaned into this effort. And the whole intent coming out of this, Eric, is that by 2030, we want to have this vision be on its way to execution with what we're characterizing as a new healthcare innovation economy. And if you go to the next slide, I'm going to be very quick about these 7 tenets because they're all very technical, and you'll hear about many aspects of them today. But first, starting with the Health Venture Collaborative, which is, think of a reverse pitch competition. You've probably heard that in the startup community where companies pitch to investors. In this case, we're looking at a reverse engineered strategy that would take the healthcare and hospital networks, identifying the problem sets that can be solved through the advancement of technologies and new product creation, and enable our startups and our formative strategists that may be in the hospitals today, maybe outside the hospitals today, but creating a venue for them to address through new ventures or joint ventures the needs of our entirety of the healthcare system. So that's going to be item 1. Item 2 is a virtual care innovation center that's being led by CEI, and the mayor will talk a little bit about this today. But what we're seeing with CEI, the Center for Entrepreneurial Innovation, with the community college and Thomas Schumann's work, has been recognized across the country for these new ventures that can be created very specifically, supported by this virtual care innovation network, which we talked about, or we'll talk about here in a minute. And it's a highly customized and specialized incubator space that really is the spine of leading healthcare, digital health, as well as a hospital at home mindset. So we're seeing such a focus of how do we move patients out of long-term care, or even short-term care within hospitals. In addition to preventative care, how do we ensure that the delivery system focuses on this kind of healthcare, hospital at home mindset that ultimately is enabled through technology. The third element is focused on what we call STEM West, which is an innovation and career hub anchored in the city of Surprise. Janine and her team at the city, along with the mayor and council, have leaned into really formulating a strategy that would affect local residents, students, entrepreneurs, engineering and prototyping, and really scaling software and augmented reality education services within the West Valley with a STEM-enriched focus that will also add to the delivery system of value within the healthcare network. Fourth is this Manufacturing and Innovation Center. This is an ASU-led project in partnership with the city and Mayo Clinic, City of Phoenix and Mayo Clinic. As Dr. Gray will talk about further, Mayo is one of our supreme assets here, not only nationally, but we're so fortunate to have Mayo here in our community. And this really specific focus on an agile kind of build to deploy scale contract manufacturing facility will house the ability to do rapid design and development of machine readable diagnostics. And this is kind of the changing landscape of approach, which will induce small batch manufacturing capacity and capabilities that will also drive new startup activity. Because you have to remember, a lot of this is about startups, it's about business formation, it's about scaling those enterprises to meet the demands of the healthcare market. So very quickly moving into item number 5, which is really focused and led by the community college system, which is a community health workforce network. I talked to Peter Fine yesterday at Banner Health where we were talking about the shortage really top to bottom of allied health professionals. Virtually every CEO I talked to of late, and even every HR professional, is talking about the shortage that exists across the country, but certainly even pervasive here. So as we want to continue the quality of care in our community, we need to figure out pathways to help graduate entry-level workers through other in-demand occupations within healthcare. And the community college has a number of programs underway in both CNA efforts as well as home and direct care and patient care technicians and so forth that will meet that demand going forward. So then very quickly on consumer engagement and access platform, there's an entity that we've worked with that's enabling the distillation of tremendous amounts of healthcare data that's really focused on the data integration around the social determinants of health. And that's also enabling a review of consumer engagement, access platforms, and having this kind of big data template available will also help feed into the healthcare venture collaborative that we can utilize then to validate market opportunities. And then finally, GPEC within all of this work and kind of being the convener and coordinating all the partnerships is that we'll serve as a coalition governance and sustainability overseer to ensure that these the kind of system thinkings beyond the grant period really works to drive transformational change. And I want to applaud the team within the Healthcare Innovation Council here at GPEC that took on a lot of this work. Kathleen Lee, our Senior Vice President of Regional Competitiveness, was kind of the core leader on this. But having this all come together is not easy. When you have a coalition, 40 plus partners with many ideas of how to drive healthcare transformation, our goal was really trying to address the needs of our community, the changing demographics, the changing points of access, as well as the quality care needs of our community as well. So all of that balancing startups and innovation too. So if you look on the horizon, if you move to the final slide here, then I'm going to hand this back to Eric. I'm a big believer that you want to spend time in areas that are going to have macro level growth. And so you think about the shifts in everything from patient care and telemedicine, the inducement of remote monitoring, smart devices, the entire shift in digital health that we've seen, really since the pandemic began. We're expecting about a 25% growth over the next 5 to 10 years in many of these areas that ultimately we're expected to have a $4 trillion national healthcare industry shift. So all that being said, we believe that we have a unique position within the ability to drive healthcare transformation. And it really gets at the heart of what you see in the upper side of my screen here is that, we are Greater Phoenix, Greater Together. In absent these kind of strategic partnerships, the expectation of excellence, we wouldn't be able to move as nimbly as we are, which we have to submit for the final proposal in March with the full notoriety of the selection from EDA coming in September. So we had a very short window starting in the fall to organize these entire parties with matching grants and matching in kind and other resources. And absent the mayor's leadership, leaders like Dr. Gray and many others that are on the line here today, we would not have been able to put this kind of sophisticated approach together. So I want to thank all of our partners. I know we're in the early innings of this long game, but we are committed to seeing this kind of intentional plan on the economy and creating a roadmap for the innovation future of our community. So with that, I will turn this back to you, Eric, and I'm excited to stay on to see and observe the panel questions and answers today. So thank you.
Fantastic, Chris. Thank you as always. And we're going to get to our panel. I'm going to introduce the faces you see coming up on your screen. Jasmine Bhatti is the founder of Navi Nurses, a marketplace connecting nurses to people in need of medical guidance and support after a hospital stay or outpatient surgery, or for families seeking additional help for aging loved ones. We have Phoenix Mayor Kate Gallego on with us. She's a strong advocate for smart business growth and investment. She's currently leading the city to global status as a leader in bioscience, technology, research, and advanced manufacturing. Chris mentioned Dr. Richard Gray. He is the Vice President of Mayo Clinic and CEO of Mayo Clinic in Arizona, the #1 ranked hospital in Arizona by U.S. News and World Report. He is a surgical oncologist and professor of surgery at the Arizona campus of the Mayo Clinic Cancer Center. Chris mentioned Kathleen Lee as GPEC's Senior Vice President of Regional Initiatives. She engages with different partner organizations, leading strategic projects that align with GPEC's modern economy plan, which underscores the need for investments in workforce, innovation, digital and physical infrastructure, and competitiveness policies. And Ehsan Zaffar is with us. He is an educator, civil rights lawyer, and founder of The Difference Engine, an ASU Center on the Future of Equality. As ASU's chief difference engineer, Ehsan works with some of the brightest students and thoughtful faculty and staff in the country to create real-world solutions to some of our nation's most daunting problems. All right, with that, panelists, thank you for being here. We're going to get into our discussion. All right, Mayor Gallego, we'll start with you. Some questions coming in. How do you think we should think about designing initiatives like this one so it can be sustained beyond the grant?
I am so grateful for all of you who have come here today to talk about the future of the Greater Phoenix region. We know that healthcare has gotten us to where we are today. It's been an exciting week for us at the City of Phoenix. We started our budget process and we have a $76 million surplus. When I was first elected, we were in a deficit. We have all worked together intentionally to diversify the economy, and we've made the very smart bet. Healthcare and biosciences is an area of excellence and an area where we know it will make our residents' lives better and create good jobs. So want to thank everyone and just celebrate in the success that has gotten us so far and gotten us to this point in the EDA's competition. If we really come together, we will take it to the next level. We've made smart investments already, but with this additional workforce, we can go to the next level. Already the convenings around this process have helped us share challenges and celebrate some successes as well. We're coming together as well on a day where we've seen some very positive trends in COVID-19 in Arizona. We're not done yet, but it is worth people like me saying thank you to all of you who have helped us get where we are. Our frontline healthcare professionals, whether you're direct delivery, labs and testing, or the associations from Greater Phoenix Leadership, the Hospital Association, AZ Bio, and others that have helped us get through a tough time and well-positioned to grow our economy. Also really want to thank the economic development leaders, including my team at the City of Phoenix. We have great assets, and the more we can all come together, bring all of our educational institutions from Bioscience High School, our community colleges and universities together, it will really help us go to the next level as a region. When I talk to business leaders, like so many of you here today, they do say workforce investments are key to our future and that hiring is a challenge right now. So with shared resources, we hope that we can convince people that this is an exciting career path for your futures, for the future of our community. And it will help us really get the full bang for the investments we've already made. Our taxpayers supported significant bioscience investment in our downtown, including bringing our universities, bringing facilities like TGen, and we should celebrate the companies and innovation and the healthcare practices that have come out of that. Oncomex, who just completed a huge fundraising round, I think 50 million Series B funding. They had the great ideas, but hopefully our infrastructure as a community helped create the right environment where that innovation could happen and thrive, and we want them to go to the next level. The city has a great partnership with Mayo. Dr. Gray will talk about that, but it's been a huge economic engine for us, as healthcare has, as well as providing care to people in our community. Many of you know I lost my mother in August to cancer. She was first diagnosed when I was running for office and getting divorced and having a baby all in the same year. So it was a tough year for me, and I wouldn't have made it to be with you here today had she not gotten amazing healthcare in this community that helped extend her life. I hope with this investment from EDA, more people can have that chance and have life-saving healthcare in our community. My goal as mayor is that if you have a diagnosis like cancer, you can get the best possible care right here in this community. We are already excelling in so many sectors, but with an investment of this magnitude, think about what is possible. So it's exciting to be with you here today, and hopefully with additional collaboration, we can continue the amazing momentum that's gotten us where we are. CBRE just said we were leading the way in life science job growth ahead of markets that you often hear about more often. So let's continue the momentum. Thank you so much, Eric.
Yeah, Mayor Gallego, thank you so much. And you just kind of summed it up there in the spirit of collaboration and partnerships. And you mentioned the Mayo Clinic. So let's bring Dr. Gray in now. And obviously a special thank you to all of our healthcare workers out there. Dr. Gray, let's start with a question about kind of a broad stroke here, envisioning the future of healthcare, specifically the role of technology and innovation. How is Mayo Clinic shaping that role?
Yeah, thanks, Eric. And I'm glad you paused to thank all of the healthcare workers, and I will do the same. People have been really working hard, overstretched, and doing a great job. So we really appreciate all of that. Yeah, Eric, it's clear that we're already in the midst of healthcare transformation in America and in the world. We at Mayo Clinic, really for the past few years in 2019, have said we explicitly want to help lead in that transformation. And healthcare really needs to transform from what has been, I'll call a pipeline model, where a person with health needs moves from one point to the next along a pretty well-defined pathway that's often set by their doctor or their healthcare organization or their insurance company, and move away from that to more of a platform model where multiple providers of healthcare services can be assembled by the person around him or her to meet their unique needs. And certainly this kind of transformation to a much more patient-centered model has been driven by some of the innovation, some of the technology adoption, but we need to get to where it is not who has a network or a system that can capture a patient into their pipeline, but let the individuals create their network through an assembly of the providers and innovators who best meet their needs. So the innovation and technology you refer to has been driving this for quite a while, but certainly the pandemic in a silver lining has brought less regulatory burden, greater acceptance of some of these approaches and technologies, and that has greatly accelerated the transition that's underway. So as an example, at Mayo Clinic in 2019, we established our Center for Digital Health, and we established a Mayo Clinic platform to meet this future. And we've already progressed much faster than we expected as a result of all those factors I just mentioned. So again, as an example of where this is going, Mayo Clinic platform seeks to simplify healthcare while in the process making it more accessible, more affordable, and more equitable as it's more broadly available. And we've created a truly open platform that can match people with healthcare needs with those that can meet those needs, even if it's not Mayo Clinic. Again, in an effort to create an open platform that will advance this transformation as quickly as possible. So we have themes within our platform, from gather to overcome interoperability issues with healthcare data, discover for using that data in a more productive way, to validate, to make sure that any algorithms from data that's developed is actually applicable to the populations we're trying to serve. And then, of course, to delivery, where we're actually putting these innovations into practice. So all of this is going to come around our patients in future years. I'll just make it real for those listening with one of the things that's been developed out of our Mayo Clinic platform. Our cardiologists used machine learning to develop an algorithm to link an EKG, which probably all of us have heard of, it's a common test, to echocardiogram results, which is a less common test, but looks for the deadly issue of heart failure. And with large volumes of data, we were able to create an algorithm that could predict silent or impending heart failure on the basis of an EKG alone. And now this is being deployed into office settings of community providers, cardiologists, or potentially in the future onto people's mobile devices and some of the monitors, EKG monitors they can do there in order to intervene faster. So these are all the pieces that technology and innovation is bringing to assemble around patients so that they can have more patient-centered healthcare, and it can be more broadly available in a simpler format as we move forward.
All right, Dr. Gray, thank you. You brought up innovation, so let's bring in Jasmine now. We're going to go from Mayo to talking about early stage firms, talking about healthcare startups. So how will this grant impact these early stage firms?
Thank you so much for, first of all, the honor of being here. I'm really excited, not only to be here as a nurse, but also as a budding entrepreneur. And when I think about funding, I've been so graciously awarded funding through the Arizona Commerce Authority and today we found out from the Flynn Foundation, which is really exciting. And so for me as a new entrepreneur, this funding means the world. It means that I can hire on the people that can actually help augment my ideas. I'm a nurse, I'm a clinician, and so I need people with other expertise that can help me advance my idea in ways that I'm not familiar with. And so hiring the right people is probably one of those first aspects of why this funding is important. We can bring in the people to help support the clinicians and the really important stakeholders. And the second part I would say is that innovation is largely an experiment, and it's really amazing to have the support of grant funds that can help you as you're trying to construct something in an agile manner that meets the demands of the people that you're caring for and providing the service to. And I think that's just amazing for our community. So I think those are probably the two most important reasons why this funding is really important for startups and for those of us just trying things out.
Fantastic. All right, Ehsan, let's bring you into the conversation now. When I was reading your bio, you know, the end of it was talking about crafting real world solutions to some of our nation's most daunting problems. So one of the questions I have for you is, how is equity being addressed and practically in the proposal we're talking about?
Yeah, hey, thank you. And thank you to GPEC for having us and putting this on. Just to take a step back, the Difference Engine, which is the center that I run, is an ASU-wide center, and we are a applied center. So we build practical solutions, a product, a process, or a service to help reduce structural inequality. And we're across all of ASU's various units and enterprises. Specifically as to this proposal, we are taking kind of three approaches. So we're looking at addressing accessibility and inequity in three kind of ways. The first is to take a systems change approach, right? And so the idea is that we don't want to just integrate solutions that have already been proposed. For instance, one of our proposals, the ASU proposal, is integrating universal design principles. But we also want to see how can our proposals advance the state of play when it comes to thinking innovatively about access and equity. So how can they be drivers of systems change? How can they change the system? So how can they produce outputs that other communities, both in Arizona and beyond, can emulate and replicate? So specifically, we're focusing on telehealth and the VCIC and wraparound services. The second approach we're looking at is taking a community-first approach. Part of that work that we're doing, you asked for practical output, so that's what I'm going to tell you. Part of that, what we're doing there is building standards and review committees inside each of the 5 project proposals that Chris shared earlier today. And so we're building in these kind of standards and review committees to the extent that they are relevant for the proposal. And in terms of our work in the governance model, which Chris talked about, really reaching out to the community and building in a budget and a structure for continuing ongoing community engagement with the various communities that are affected by healthcare outcomes and equity outcomes. And then the last thing is we're data driven. So again, Chris has touched upon this earlier, but one of the things that we're doing at the Difference Engine is helping to build a community-facing data portal. Data should be transparent, accessible, and free. And to the extent that community organizations, CBOs, NGOs can use that data to make conclusions based on the work that we're doing in the community, we want that to be accessible and available and create a place for conversation. And the other thing I'll say, Chris or Eric, real quick, is that we've done really well in the greater Phoenix area when it comes to advancing on health outcomes, but there's still a lot of work to be done. We've seen the impact from the economic impact from inflation affect healthcare outcomes. It's a social determinant of health. Misinformation, which is not talked about as much, targets vulnerable communities, in particular low-income communities and communities of color. We've seen a little bit of that with the COVID vaccine issues. One thing that's very particular to Phoenix is climate change and transportation security. They're tied hand in hand. Places which tend to be hotter tend to have problems with transportation infrastructure that makes it harder for people to get access to healthcare. And then, of course, the racial disparities, although they're improving in many areas in the greater Phoenix area, still continue to persist, especially with Native American and Pacific Islander communities. And so that's another area we're focusing on in particular.
All right, Ehsan, thank you for that. All right, Kathleen, I know throughout the webinar today, you're going to be talking about how companies can get involved, but I want to give you the opportunity to kind of touch on, what Chris was talking about, and then what we've heard so far of how important this grant opportunity is for us as a region.
Thanks, Eric. So I would like to, speak from an economic development perspective about this opportunity. As Mayor mentioned, and everyone on this panel knows, healthcare is a big economic engine in our region. It's the second largest by employment concentration, and the national healthcare is a $4 trillion market. But generally, when people think about healthcare, they think about the role that the health systems play in terms of keeping us healthy. They don't necessarily think about innovation and healthcare, even though, as Dr. Gray mentioned, innovation is as fundamental to healthcare industry as the technology sector. And so that's why our regional cluster strategy for the EDA proposal really focuses on accelerating and integrating the new healthcare innovation economy. This economy is an ecosystem of a lot of related industries, including healthcare providers, payers, medical device and tech companies, business service providers, research institutions, and communities. So it's a big ecosystem with lots of different players. And this economy is expected to grow, generating, just in our region, generating 2 out of 5 jobs gained between 2020 and 2030. And it's going to be 1 out of every $5 of economic output in 2030. So through this process, every time when we met with doctors and administrators and innovation leaders in the healthcare system, we were just blown away, incredibly amazed by their creativity and excitement around innovation. And there's so many great ideas. Dr. Gray mentioned some of the examples, great ideas, inventions, startup activity in the healthcare industry. So if we're successful securing the EDA grant, we can connect all of these industries and participants in the ecosystem in a much more seamless way. And we can build and expand capacity and infrastructure for developing solutions that providers and communities need. We can deploy these solutions in the real world through new companies and new joint ventures. We can, dedicate resources to innovation teams, as Jasmine mentioned, to build prototyping and small batch manufacturing capabilities and retain and attract workers into the healthcare careers. So it's a really exciting opportunity. So for us, accelerating and integrating healthcare innovation economy will make our region more resilient to future pandemics and other external shocks. But with this EDA funding, which is, just really sort of a very unique one-time opportunity, our region will have this greater connectivity between, healthcare, technology, manufacturing, and business services, more specialized companies like Jasmine's, and talent, and a strong pipeline of workforce. So, we anticipate, this effort is really going to lead to more competitiveness for our region, our ability to attract more companies and investors, because they want to be in Greater Phoenix in this kind of vibrant ecosystem.
Thank you for that, Kathleen. Mayor Gallego, let's talk more about that ecosystem, and particularly where healthcare and municipalities can overlap. Talk to us about that.
Wonderful. Our healthcare ecosystem has been a huge driver of economic activity. We are already ramping up to some of those numbers that Kathleen just mentioned. If we look at our construction industry right now, healthcare has been a huge area of investment and a job creator for us. We are been building in my city and the greater Phoenix area, some of the most advanced buildings in healthcare. And we have great engineering, architecture, and other firms that have really helped propel us to that level of excellence. As mayor, I get to brag nationally and internationally about some of the great innovation, but also the built environment we have here. And some of the Phoenix-based companies have really led the way in creating great spaces for healthcare that have spanned the spectrum from incubating our startups to being able to really flex and react to the major healthcare challenges, including COVID, that we have experienced. So that's been very important to us, and we hope to continue. We've also really needed the partnership. The city of Phoenix does not have we are not the public health provider, it's a county function here, but we've really appreciated the partnership and being able to step up to fight COVID. Our laboratories from Sonora and Quest, folks like TGen and others helped us early on getting the data, and that was key for us in being able to react and hopefully do a little bit to support Jasmine and all of the nurses who are out there on the front lines. To have even more robust ecosystem will help us with whatever challenge is in the future. I'm also really attracted to the industry because of the huge diversity of jobs that it creates. So we have folks at Exact Sciences solving global problems in this community, but we also have people like a woman named Monique, who I met when she was at a Native American Connections shelter. She had gone from homelessness to studying for a credential in dentistry and went on to a robust profession in that career. So to me, healthcare is the kind of industry with jobs that I would want for my family, where we have good benefits, career paths, and you can do such meaningful work. So when Kathleen says 2 out of 5 of our future job creation can be in this industry, if we come together and make these investments, that's the kind of legacy that any mayor would want to leave behind. So appreciate all your partnerships in helping us get there.
All right, Dr. Gray, the EDA has emphasized cross-sector collaborations as a competitive factor. So what are some examples that we should be communicating in the proposal?
Yeah, as the mayor just mentioned, we have to have great collaborations to make our proposal competitive, and more importantly, really to make all of this ecosystem that we're trying to further in our communities more successful. So, we've talked about the Manufacturing Innovation Center and having organizations that perform medical research like Mayo Clinic, ASU and others, plus healthcare organizations like Mayo Clinic and others, plus device and manufacturing organizations like Medtronic and Samsung and our public sector partners. You put all of that together in something like the Manufacturing Innovation Center that Chris was mentioning earlier, and it becomes much more powerful. And the transformation of healthcare that I mentioned earlier probably won't happen, or certainly won't happen as quickly and efficiently unless we have strong cross-sector collaborations. Yes, there are things that Mayo Clinic is doing on our own. Mayor Gallego, mentioned some of the investments. We're in the midst of a $750 million expansion on our Phoenix campus that is very important. But there are a lot of built-in collaborations there. And beyond that, in some of the transformational elements that I mentioned earlier, we have to partner with innovators, with startups, with early stage companies, and with established players that can add complementary capabilities to serve the people we want to serve better. So we've used a company called Inference in data security and de-identification, Triple Blind in making data usable without making the data itself accessible for security. Medically Home, we've co-created a platform so that any healthcare provider can provide hospital level care to patients within their home with a partnership with Medically Home, Mayo Clinic, and Kaiser Permanente, among others. And even Google. We've created algorithms that help with cancer radiation planning and dosimetry to increase quality, decrease cost and time, and spread expertise more widely and equitably. So we have to piece together all of the people with capabilities that together more rapidly will produce that kind of platform environment that we need to have the patient-centered future of healthcare that we want to have. And we're continuing to try and push on that. You don't always need physical proximity, but Mayor Gallego sort of alluded to, Mayo has also purchased additional land around our Phoenix campus, and we plan to have on that land something we're dubbing Discovery Oasis, which can be a zone for those kinds of collaborations, including collaborations where physical proximity can really create an ecosystem that will move things forward much more quickly. So collaborations are essential. Healthcare is complex. Innovators need innovative incumbents like Mayo Clinic to help navigate the landscape, but innovative incumbents like Mayo Clinic need the innovators and disruptors also to come together to produce what's best for patients.
And with the future of healthcare, I want to spend a little time here on the workforce. And let's bring Jasmine and Ehsan back into the conversation. And Jasmine, let's talk about systemic changes and what you see needs to happen, or some of your biggest challenges as we try to focus on the entire spectrum of the workforce here, from home, community health workers to nurses. What are some of the biggest changes, biggest keys you see?
Sorry, just to kind of piggyback on what Dr. Gray was explaining, is that the collaboration is so critical, and it's collaboration across all of these partners that provide care, from the hospital setting to the home setting, and then these outpatient clinics and every other facet of healthcare. And I think what we realized is that the way we've always done healthcare, it's just simply not working. And we need to find a way to collaborate together. And I think that's why this dialogue is so exciting to me today, is that we're bringing together people, and this opportunity with the funding will hopefully help facilitate that and make that happen. And I think COVID has been that silver lining that's, in a way, it's just shown us that we can do so much better, and we really need to, and now we have this opportunity to. When I think about the systemic changes that need to happen, as a nurse who worked the front lines up until last April, I think about, there's no system without people, and we need to focus back on the people who are providing the care, not only healing and supporting those of us who have gone through this over the last few years. Because when we think about nursing, for example, they're a significant portion, we're the largest part of the healthcare workforce, and yet 60% of us who worked through this are saying we want to leave the profession altogether, and we don't have the ability as a community to lose these precious resources who have years of training, who hospitals and organizations have invested so much money and time and resources towards. We need to try to find a way to keep them working in the hospital, support them, because not only are they critical for the care that they're able to provide, but when we talk about bringing on a larger workforce to help augment and support the growing population and what we're seeing, we need a transfer of knowledge. Like, some things that we experience, you don't learn from books. It comes from the people that have taught you ahead of time. And so really supporting those people is really, honestly, the most critical portion for any systemic change in my eyes. And I think we've talked about that, just the collaboration and having improved communication across all of these different players. And just think about the average person, their experience in a healthcare setting, they're working across so many different groups of people, and it's overwhelming for them and their families. So how can we make the system better, not only in terms of how we communicate with each other, but the documentation systems like our electronic medical records, and how people can have access to that so they actually have an accurate understanding of what's happening to them. So I think those are probably my biggest points as we look forward to creating a more sustainable and exciting workforce.
Ehsan, what are your thoughts on that? Talking about these systemic changes that you're seeing and you're addressing.
Yeah, I think Jasmine did a really good job of talking about the internal actions that may need to be taken in the workforce. And I think I'm not going to add much more to that because she's the expert there. But what I can say from an external perspective is one thing, and that is I think if COVID has highlighted for the ordinary American anything, it's the fact that these issues are integrated. They're intersectional, right? It's a system where you were talking about systems change. So these, healthcare does not exist in some kind of silo, right? It exists with all kinds of other determinants of health. There's a question there on the Zoom, so I may be partially addressing it at this point, that was asking about how do we integrate, food delivery into these issues. 42% of Phoenicians live in a food desert. This is a startling statistic. And access to healthy food is a precursor to all kinds of, or lack of thereof is a precursor to all kinds of health issues down the line. So what we're trying to build into this proposal is a systems-wide thinking, a broader thinking of, what is health? How do let's take a different definition of what we think as health and promote that definition, and leverage that broader definition of what health is and healthcare is. From mental health to things like access to healthy food, or addressing the healthcare related challenges that arise from changing climate.
Question coming in for Kathleen, specifically about GPEC. The region is still finalizing the phase 2 proposal. So how do you think GPEC's unique status as a public-private partnership can help the proposal's chances?
Thanks for that question, Eric. And I think we talked a lot about the complexity around innovation, around healthcare, systems change. I think one of the things that the EDA has called out in our phase 1 proposal is the kind of the strength that we were able to demonstrate around our regional collaboration and our public-private partnership model. And I think this is something that we can really build on in the healthcare space for this opportunity. GPEC's been a public-private partnership for over 20 years. I think that type of collaboration is going to be really, really important. And one of the things that I wanted to kind of add on to the conversation here is around workforce, is that we have a lot of great assets in the workforce space. We have leadership from the healthcare providers in terms of building out career pathways that can help a lot of different kind of entry-level workers move into great career jobs. We have community colleges and even our K-12 system. We're working with our high schools and helping them to look at healthcare as a career, as an entry point. But we know that because of COVID and because of the situation we're in, there's a lot of churn right now in healthcare sector as well as in others. And so, we want to help build with this grant opportunity, we want to help build that pipeline into those entry-level careers, and then also map out a career pathways for those folks to explore other areas that are great opportunities, and then new jobs that's going to be created through this transformation model in healthcare. So I think there's a lot of great leadership, and I want to thank everyone on this panel, the industry leadership, in the audience, the political and civic leaders that have really supported this effort, because this is what is going to help us, get to the finish line on this proposal.
We're going to get to some final remarks in just a minute, but I do want to get to another question that just came in live. And this is for everybody, but maybe Ehsan, because you were talking about access to food, you can kick us off here. Tech innovations are integral to creating health equity for underserved populations. For example, we've seen that drones are serving as a healthcare essential delivery mechanism for those on the Navajo Nation. how do we advance innovation and translate it to increasing opportunity for all, while also supporting those delivering care on the ground floor? So if you want to kind of kick us off, and if anybody wants to weigh in, feel free.
Please do weigh in. I'll speak from a specific perspective. That's a great question. There's a lot to unpack there, and I don't know if we can do it in the few minutes we have left, but my broad response would be that all phases of the proposal, all parts, all the component parts of the proposal on our end do build that in. So we build in the space for tech entrepreneurship, right? So that's already built in, as you've heard from many of the speakers. The role of the engine, the difference engine, was founded, I had this idea, what if we paired entrepreneurship with civil rights? What would that look like? And so that ethos that we built into the difference engine is what we're trying to build into this proposal. We don't think that social justice and entrepreneurship are mutually exclusive. They are, they work really well together. And so a lot of the work that we're doing on this proposal is to build in an approach where we look at, okay, great, we have entrepreneurship and we have applied output, right? How do we govern that applied output? How do we ensure that that applied output benefits not just people that are coming in to work at some of these startup incubators, but also the communities that their product is meant to support? How do we ensure that an Apple Watch and the sensor behind the Apple Watch, which tends not to do a good job of assessing the heart rate of a person with darker skin color, maybe that's a tech innovation that we can work on and encourage, so that it's more accurate for people with darker skin color. And the way we're doing that practically, like I mentioned before, is having these kind of embedded standards and review committees, these kind of built by the community for the community in many of these proposals, and also in the governance work that we're doing as alongside GPEC, once the proposal is, hopefully, fingers crossed, does well with the EDA. So I'll let others comment more on the specific tech innovation and entrepreneurship piece.
Anybody else want to jump in before we wrap up here?
A couple quick points. One, the American Rescue Plan, which is funding this, also funds some other programs we have at the city around food entrepreneurship. And we have programs focused in South and West Phoenix that really have an eye to health and equity. So not as central to this, but you're giving me some ideas we might be able to combine the two. And then we have some great programs already in this community. I'll spotlight one with our community college that the Secretary of Labor just visited, where it helps both healthcare professionals, hospice professionals, CNA training, but also anyone who's doing care at home, sort of going back to where we started with this, just understanding how to move people, what technology is available to move your loved one who might be in end of life or facing a difficult diagnosis. Home healthcare is another area we hear often in this community. There are jobs to be had, and the more we can provide training and skills that make that perhaps a more lucrative, but also a less physically taxing career path, the better. The community colleges has great assets, and if we have more resources to go to the next level, we can really help there. Center for Entrepreneurial Innovation has been great about bringing forward small businesses that can help address the needs in our community. And the Economic Development Authority provided key funding in partnership with the city to really get to get CEI off and running. But again, an investment of this magnitude is something that could take us to a whole additional level and allow these great resources to get to more of our community. So,
all right, Mayor Gallego, yes, thank you. We're gonna kind of go around the panel now and give everybody an opportunity to kind of share some closing thoughts. Dr. Gray, as I think it was Jasmine who pointed out, just this type of dialogue, bringing people together, having these types of discussions is so critical. I'll let you kind of wrap us up here on everything that you've heard today and what you're looking forward to.
Yeah, it's certainly exciting to see how people pull together with an effort like this. And I really believe that we will be successful in this endeavor, that we will receive funding. But even if we're not, the fact that we've thought about these issues, the fact that we've brought partners together, the fact that we're fostering more collaboration and we're thinking about the ways to fill some of these gaps will pay dividends regardless. And it will pay dividends even if we're funded through the grant, beyond even the grant itself as we continue those relationships. So it's exciting to think about the entrepreneurship, about the innovation and how we fill these gaps. But as we've just heard with food insecurity and other items, there's basic infrastructure and basic healthcare. And something we learned from the pandemic is we need hospital beds when people get sick. And so there are a lot of components that are maybe less exciting, but need to be a part of this discussion that I think is really coming together through this, regardless of the outcome, even though I remain optimistic about the ultimate outcome.
Jasmine?
Yeah, I would just like to say, first of all, I think it's a really thoughtful group of individuals and organizations that are part of this dialogue. And I think that's the first step here. And it's exciting to see what we can do. I think Arizona is in this incredible position where we have tremendous resources through our universities and our healthcare systems that there is no other state, I think, that can do it probably as well as we can. And that's really exciting. And I look forward to having this funding available to us so we can look to the future and hopefully role model to the rest of the country new ways of seeing and doing things.
Ehsan?
Yeah, thank you. I think I'll just leave everybody with this, with a thought that our focus with this proposal and with the center at large is to focus on the community and the individual that is being served, right? So who is the recipient of the problem and what can we do to empower them to change their own situation? So there's a question in the Zoom I don't think we had the chance to get to about talking about how do we educate patients. I think a lot of patients, I think that's part of this problem, that we think that maybe patients are uneducated. I think that they often know what they need. But I think that caregivers either don't have the cultural awareness or don't have the courage or the time, frankly, given COVID, to meet those needs. And so part of what we're building here is kind of building an infrastructure that allows them the space, the time, and the awareness and knowledge to meet the needs of the patients that they're serving.
Mayor Gallego, another fantastic conversation. We always have them on the regional reports here. Some closing remarks?
We have so many partners who've been willing to make a 20-year commitment towards this project. I hope that we'll all come together and remember this Zoom as really kicking off something that we were all so proud to be part of. So thank you for the people online for the gift of your time. It is a pleasure to be part of a city that values innovation with an academic and business community that are great partners in healthcare.
All right, Kathleen, tell us how to get involved. Bring us home here.
Thank you. And I want to thank the panelists and the audience for their time today and for wonderful remarks and the discussion. There are so many ways that the companies can participate in this effort. We can certainly benefit from their unique perspectives and expertise. So we would love to hear from you and get your feedback on our component projects. We would also welcome, time and resource commitment through the different phases of this initiative. So as Dr. Gray mentioned and others, we're very optimistic, and this is an ongoing process. This won't end on March 15 when we submit our proposal. It's going to continue. So we're very excited. So please stay engaged with us and use the QR code to access the survey.
All right, Kathleen, thank you to GPEC. Thank you to all our panelists. And as everyone's mentioned, thank you to everyone watching and spending some time with us this afternoon. And we'll see you next time on the Regional Report.